Hello, my name is Katie Burgauer. I'll be discussing the community of Largo, Florida in my presentation. The objectives of this presentation are to discuss key components of Largo. I will be discussing the historical overview of the community as well as community analysis and a community and global problems. Individuals started settling in Largo in the early 1800s. By 1886, a railroad was formed cutting through the town as a shortcut. It is said that Largo is named after a town in Scotland. Largo was officially incorporated in 1906, and by 1913 it had the first organized government in Florida. Largo was known for its citrus fruits, therefore was named the Citrus City. In 1950, the community of Largo consisted of 1,500 members. Today, there are over 75,000 community members in Largo. There are over 38,000 households in Largo today. This community stretches over an 18 square mile radius that has grown over 13% in the last 10 years. This community has an abundance of schools. There are 26 K-12 schools, 5 of which are private schools. Some of these schools are also magnet schools for gifted students. Along with these schools, there are 29 different preschools available to children under 5. When compared to neighboring communities, Largo has as many, if not more, schools than many of the neighboring communities. When comparing Largo to other neighboring communities, Largo has a lot more to offer. Largo has a 425-bed acute care hospital with 2 locations. Many neighboring communities do not have their own hospital incorporated into their community. There is also a large Largo Park that offers holiday festivals, exercise equipment, and picnic areas. Located in the middle of the park is a community library available to the public. Then there is also a recreational center that offers camps, aquatics, exercise classes, and numerous other activities to the Largo community members. After interviewing Largo residents, many members are pleased with what Largo has to offer and believe that Largo offers more than many of the surrounding communities. The majority of Largo's population are Caucasian individuals. The unemployment rates are similar to surrounding communities with a rate of 6.7%. Nearly 13% of Largo community members are living under the poverty rate. That is less than some of the surrounding communities such as Pinellas Park, but is much greater than other neighboring towns such as Belair Bluffs. Over 1/4 of the community relies on government assistance. Largo has a much lower educational rate compared to many neighboring communities with an average of 87% high school or above education level in individuals over 25. Low income and low educational levels can contribute to decreased health management. Smoking and drinking are concerning in the community. Over 70% of individuals in Largo admit to drinking alcohol, and over 25% admit to smoking cigarettes. This is consistent with many neighboring communities. The community is dealing with this by developing more support groups and AA meetings. Heart disease is the leading cause of death for individuals in Largo. This is consistent with many of the neighboring communities as well. Obesity is also a leading cause of death and health concerns in the Largo community. 1 of 3 children in the community are overweight. After speaking with other Largo residents, many of them believe that obesity is caused by the overabundance of fast food restaurants in the community as well as the lack of indoor exercise equipment. There are numerous indoor gyms that have a high monthly payment, but there are few that are available to the public for a low price. It is noted that many children are not playing outside and exercising because of the heat in Florida. There are many health-related resources available to residents of Largo. They are easy to access and affordable to the community. The health department offers all services for free to children and those who cannot afford health care. The Pregnancy Clinic of Pinellas County offers free health care for all pregnant women. There are also rehab, skilled nursing facilities, and assisted care facilities that have varying costs depending on insurance coverage. There are also 2 Largo Medical Center campuses available to community members. A psych hospital is within one of the campuses, and 3 walk-in emergency rooms are available to Largo community members. I chose 3 objectives from the Healthy People 2020. The first objective I chose was to improve cardiovascular health. This is a leading cause of death in this community as a result of poor cardiovascular maintenance and education. Secondly, I chose the reduction of substance abuse. Substance abuse in Largo, as well as surrounding communities, is very high. Substance abuse accounts for many deaths in this community every year. Finally, I chose nutrition and weight control for my third objective. Obesity is out of control in this community. The conditions lead to numerous other medical conditions that could be avoided with a healthy diet and exercise. The Largo community offers parks and a new recreation center to its community members. After interviewing community members, many residents were concerned that there were not enough indoor community events for the community, allowing them to get out of the heat. This is an issue that is concerning the residents. They seemed happy with the amount of parks in the community, but wish there were more exercise equipment available in these parks. Many members mentioned that they were impressed with the new Largo Recreational Center that is now available to the community. There is also a walking trail that travels through Largo, allowing members to exercise, as well as an outdoor mall available to the community. During my windshield survey, I noted many of the households in this community needed renovation. Many driveways were rugged with large cracks, roofs were damaged, and yards were unkept. These houses decreased the market value for other houses in the community. Many of the sidewalks in neighborhoods had been damaged, leaving large gaps that can be dangerous to children and people on bicycles. Many community members are worried that there is not enough exercise equipment available in the community, thus contributing to the problems with obesity. The individuals I interviewed stated that it's too hot to exercise outside most of the year, and that there's only one community center that offers reasonably priced exercise classes with equipment. But for some residents, this is too far away. They believe their tax money should be going towards making another location for exercise. This community has a very supportive and caring government consisting of a mayor, his councilmen, commissioners, city clerk, and vice mayor. They provide help to residents, and residents can schedule meetings if needed. There is a website available to community members to keep up with public policy, and monthly meetings are listed that residents are free to join. There's also a local government channel that keeps residents updated. The number one community problem that I found was heart disease. Heart disease is the leading cause of death in this community and requires action to fix this problem. Education and teaching are essential to the community. Secondly, I found obesity as a growing issue in the community, leaving 1 out of every 3 children overweight. Exercise and healthy diet need to be properly implemented in this community. Thirdly, I found that alcohol abuse is a serious problem in the community, with a mortality rate of over 75% for all accidents that were due to alcohol. Number 4 on my community problem list is poverty. 13% of Largo residents live under the poverty level. This is better than some of the surrounding communities, but still needs improvement. Number 5 is infrastructure. When performing my windshield survey, I noticed that there are few bicycle lanes and many neighborhoods have damaged sidewalks that lead to safety issues for children and bicyclists. Many individuals ride their bikes to work, and there are not proper lanes for them to travel in. Finally, I learned that residents find that Largo lacks enough entertainment. They need more community centers, community events, and facilities to facilitate entertainment to help reduce the stress of everyday living. This prioritization is based on the level of importance, with health problems being the number 1 and entertainment being the least important. Poverty is a worldwide problem that is being dealt with across the globe. Many poor countries rely on donations from powerful and wealthier countries. In Largo, poverty is noticeable in certain neighborhoods. This community is working to provide more jobs and clean up the community. There are programs that can aid individuals with low income. The nurses that work in the community can work with low-income families to assist them in developing a plan and teaching residents about programs and resources available to them. Promoting healthy behaviors and teaching the importance of medical care is also the duty of the community nurse. Thank you for listening to my presentation. Here's a list of my references.